Hi, I'm Dr. Helena Lim, one of the fertility specialists in KL Fertility Center. Today, my topic is actually about infertility, or more importantly, more accurately, we should be calling it subfertility. Now, the definition is subfertility is the inability for a couple to conceive after trying for 12 months with regular sexual intercourse. Now, the reason why is it so is because we know that about 84% of the couples would have had conceived by the time they reach 1 year mark. Now, if you and your partner has been trying for more than 12 months and still have not achieved a pregnancy, it is time for you to see a doctor to check what are the things that prohibits you from getting pregnant naturally. But it is also important to note the age of the female partner. Now, if your female partner's age is more than the age of 35, then you should be seeing a doctor if you have not achieved a pregnancy by 6 months. Now, there are many causes for infertility. There are actually 30% is actually due to the female factors, 30% is due to male factors, and about 30% is due to both female and male factors, and about 10% of subfertility is what we call unexplained subfertility. Now, if you ask me why the age of 35, Dr. Helena, now it is important to note that medical statistics have shown that after the age of 35, our ovary, the number of eggs that we produce in our ovaries, as well as the quality of eggs that we produce in our ovaries, actually reduce remarkably. So even if you try to get pregnant naturally or a fertility treatment such as IVF, we know that your success rate actually started to reduce gradually after the age of 35. But if you actually hit the age of 40, your chances of pregnancy, even with IVF, reduces remarkably. Okay, so we know that at the age of 40, your chances of pregnancy at the age of 40 is actually about 40%. But by the time you reach the age of 45, your chance of pregnancy is almost zero. So therefore, even though IVF remains one of the most powerful tools we have to get you pregnant, but we know that it will never ever be able to reduce or reverse the damage of aging problem due to your ovaries and your fertility. I would say that the best age for pregnancy would be between 25 to 35. Now, we know that if you actually are pregnant before the age of 18 or below, we know that there is actually a higher risk of high blood pressure in pregnancy. The risk of having anemia in pregnancy is also higher. The risk of having an operative delivery such as cesarean section is also higher. Now, the reason being so is because between the age of 25 and 35, that will be your peak performance in terms of your physical as well as your mental performance in terms of your reproduction. Now, if you are actually over the age of 35, we know that your risk of having high blood pressure in pregnancy, diabetes in pregnancy, miscarriages, and also fetal anomalies is also higher after the age of 35. It is also important to note the age of the male partner as well, because we know that if your male partner's age is advanced, it is associated with reduced sperm quality and quantity, and it is also increased risk of autism in the offspring if your male partner's age is advanced.
If you like our channel, please like, share, and subscribe.